Do you remember when you were in school and you had that one class, not the bad one, the good one, the one where the content was really interesting and important? You know the one I'm talking about. Remember how you made sure to take good notes because you knew it was good stuff and you wanted and even needed to remember it? Well, this video is full of that same good stuff, the kind of information that can transform your dental practice and significantly impact your success. So, I invite you to grab some paper and a pen right now and get ready to take some notes. You'll absorb the content better and be ready to apply it faster. So sit back, relax, maybe grab your favorite drink, but remember, pay close attention and take notes. Now, here's the good stuff. 49% of dental practices achieve case acceptance rates between 40 and 70%. Yet the average case completion rate is only slightly over 40%. For the average practice, this gap represents 200 to 500,000 in lost annual revenue. Welcome back to the Practice Transformation Series. I'm Mike Kulwiec, the founder of Trivanage. Today, we're addressing what might be the most expensive problem in dentistry. It is the gap between case acceptance and case completion. Let's consider again a statistic that should concern every practice owner. Nearly half of all practices achieve acceptance rates between 40 and 70%. However, the average case completion rate is only 42%. Think about what this means for your practice. If you present $1 million in treatment plans annually and achieve a 60% acceptance rate, you should expect 600,000 in completed treatment. But if your completion rate is only 42%, you're completing just 252,000 in treatment. That's a $348,000 gap between what patients accept and what they actually complete. For many practices, this can represent the difference between struggling financially and thriving. Today, I will show you exactly why this gap exists and, more importantly, how to systematically close the gap and dramatically increase your practice revenue. To understand why patients accept treatment but don't complete it, we need to examine what happens between acceptance and completion. The most common reason patients don't complete accepted treatment are financial concerns. These are concerns that weren't properly addressed during case presentation. Many practices focus on clinical benefits during case presentations, but don't adequately address payment options, insurance coverage, or financing alternatives. Patients may accept treatment in the moment, but then later realize they can't afford it or don't understand their payment options. With the help of Trivanage, Dr. Myers in Arizona learned that 60% of her incomplete cases were due to financial concerns that could have been resolved with better payment planning and financing options. Now, life gets in the way of dental treatment. We know this. Patients accept treatment with good intentions, but then face competing priorities, work demands, family obligations, health issues, or simply the tendency to postpone non-urgent care. Without systematic follow-up and appointment management, these patients drift away from your practice. Some patients accept treatment but then seek second opinions or research alternatives online. If they find conflicting information or lower prices elsewhere, they may not decide to proceed with your recommended treatment. This is particularly common with expensive or elective procedures. Many practices don't have a systematic process for managing patients between acceptance and completion. Appointments are scheduled weeks or months in advance, often with minimal follow-up or engagement. Patients forget why the treatment was important or lose motivation to proceed. Some patients experience anxiety about dental procedures and it wasn't adequately addressed during case presentation. Fear of pain, concerns about the procedure, or general dental anxiety can prevent completion even when patients intellectually understand the need for treatment. Now, let's review the systematic approach successful practices use to close the completion gap and dramatically increase treatment revenue. The foundation of high completion rates is comprehensive case presentation that addresses all patient concerns up front. This means presenting not just the clinical benefits of treatment, but also addressing financial options, timeline expectations, and any concerns the patient might have. Effective case presentation includes visual aids that help patients understand their condition and treatment options. A clear explanation of what will happen during treatment is essential. Discussion of all payment and financing options and addressing any questions or concerns before the patient leaves. Dr. Chen implemented, with our help, a comprehensive case presentation system and increased her completion rate from 38 to 71% simply by ensuring that all patient concerns were addressed before treatment acceptance. Financial barriers are the most common reason for incomplete treatment. Successful practices offer multiple payment options and work with patients to create affordable treatment plans. This includes accepting multiple insurance plans. Now, if your practice is out of all networks, then the practice team should follow a consistent process to help the patient obtain maximum benefits. Smart practices offer in-house financing or payment plans that partner with third-party and financing companies. You are transparent about all costs up front. The key is making treatment affordable and accessible rather than assuming patients can't afford recommended care. Systematic follow-up is essential for maintaining patient engagement between acceptance and completion. This includes appointment reminders that reinforce the importance of treatment, educational materials automatically sent via email that maintain patient motivation, check-in calls to address any concerns or questions, and flexible scheduling to accommodate patient needs. Dr. Rodriguez, another Trivanage client, implemented a systematic follow-up program and reduced his incomplete case rate by 55% simply by using our automated system to maintain regular contact with patients between acceptance and completion. Many patients need time to mentally prepare for dental treatment. Successful practices provide education and support that helps patients feel confident about their treatment decision. This includes educational materials about procedures, testimonials from other patients who have had similar treatment, and clear communication about what to expect during and after treatment. Some patients benefit from sedation options and other comfort measures that reduce anxiety about treatment. Scheduling does play a crucial role in treatment completion. Patients are more likely to complete treatment when appointments are convenient and well managed. This means offering flexible scheduling options, minimizing wait times, and grouping related procedures efficiently. Some successful practices offer extended hours or weekend appointments to accommodate working patients. Others use block scheduling to complete multiple procedures in fewer appointments. The goal is making treatment completion as convenient as possible for your patients. Treatment coordination ensures that complex cases proceed smoothly from start to finish. This includes clear communication between your team members, systematic tracking of treatment progress, and proactive management of any issues that may arise. Patients should never feel confused about their treatment plan or uncertain about the next steps. Now, you might be thinking, how do I implement these automated systems while managing a busy practice? This is exactly why we developed our integrated approach at Trivanage. Our patient care management system includes automated patient communication that maintains engagement between appointments, financial planning tools that help patients understand payment options, and systematic tracking that ensures no patient falls through the cracks. Dr. Myers, who I mentioned earlier, implemented our complete system and achieved incredible results. She increased her case completion rate from 45 to almost 80%, which translated to an additional $380,000 in annual revenue from the same number of case presentations. More importantly, her patients are happier because they receive the treatment they need rather than being stuck with incomplete care. The gap between case acceptance and completion is a large untapped revenue opportunity in most dental practices. By implementing systematic approaches to case presentation, financial planning, patient communication, and treatment coordination, you can dramatically increase your completion rates and practice revenue. Practices that are thriving understand case completion is not about pressuring patients. It is about removing barriers and providing support. It's about helping patients complete the treatment they've already accepted. If you're ready to close your completion gap and unlock the revenue that's already in your practice, I encourage you to download our Practice Transformation Guide. It contains detailed step-by-step instructions on how to implement these concepts. Now, if you'd like to discuss how to close the gap with our help, schedule a complimentary practice success call with me, Mike Kulwiec. Together, we'll review your gaps and quickly identify how you can close them so you can soon generate significantly higher revenue and higher practice income. In our next episode, we'll discuss profit margin optimization and how to increase practice profitability. Strong profit is the domino that knocks down obstacles and opens the path to a long-term, stable, rewarding, low-stress practice. It's the kind of practice you deserve. Be sure to subscribe and hit the notification bell so you don't miss future episodes. Practices that have closed the gap are thriving, and they made the decision to implement systematic automated solutions. The question is, will you join them? I hope so. Thanks for joining me, and I'll see you in the next video. Meantime, cheers.